Hello and welcome everyone. My name is Dr. Manickam and I'm a pediatrician. I went to Brown for medical school, Columbia for residency, and now I'm at Children's Hospital Los Angeles to specialize in the NICU. And today we're going to talk about vitamin D supplementation and iron supplementation. So as soon as you bring your baby home, it's important you give them vitamin D. 400 international units every day. That ends up being about 1 milliliter, so just a couple drops of vitamin D that you put into your baby's breast milk or formula before you give that to them. As long as they're on breast milk, so usually the first 12 to 24 months of their life, and if they're only drinking breast milk, then you want to give that vitamin D every single day. It's the one thing that breast milk does not really give you enough of. For formula, if your baby's primarily formula fed, once they're having over 32 ounces of formula per day, then you can stop giving vitamin D. But before they're having over 32 ounces of formula per day, you want to still give vitamin D every day, that 1 milliliter per day. The other thing that parents often ask about is iron supplementation. So for babies who are preterm, they're born before 37 weeks gestation, you probably start an iron supplement at 2 to 4 weeks of age. Your pediatrician can help you with the dosing of that. For full term, and then once you start, and then I should say, that's for preterm babies who are primarily breastfed. If they're formula fed, formula has iron in it usually, and you can talk to your pediatrician, but usually that's enough iron for your baby. For full term babies, once they have enough iron in their bodies for the first 4 months of life, so only after 4 months of life do they need an extra iron supplement. But because most full-term babies at 4 to 6 months of age start solid foods, they actually don't ever need an iron supplement. The extra solid food they have has enough iron in their diet to give whatever iron they need. So the reason why preterm babies need iron supplementation starting at 2 to 4 weeks of age is because they don't have iron stored in their bodies. They don't have that benefit of staying within mom long enough to actually store that iron. Full-term babies, on the other hand, they've had enough time to have some iron stored in their bodies. That way, in the first 4 months of life, even if they're breastfed, they have enough iron to support them. And only afterwards do they actually need some extra help. But because you start solid foods usually around 4 to 6 months of age, and there's iron inside of that, they get enough iron at that point. So in summary, preterm babies typically need iron starting at 2 to 4 weeks of age, especially if they're breastfed with formula feeding. You can talk to a pediatrician to see if it's enough formula to give them enough iron. For full-term babies, usually no iron supplement until 4 months of age, but if you're starting solid foods at that time, you actually don't need an iron supplement at all. If you have any questions, please send us a message, DM us, and here are a few clarifications as you listen to all of our videos. Second, all the information that we share is my own clinical opinion and not related to any of the other institutions I've been a part of before or are currently. And third, for all the medical providers in the audience, if you have any other advice that you would like us to include, please send us a message. We're happy to try to include those things as well. If you find our videos helpful, please like and subscribe to our channel below and share with your friends. Thanks for watching. Take care.